After we've done the tumescent anesthesia, we go in initially with a 2 or 3 millimeter PAL cannula, and we're going through to create little tunnels through the fat. Once we've done that, we then move up to a larger cannula, and we start seeing a lot of fat coming down at that point, and one can feel, and when you're just touching the abdomen, you can feel that the upper surface is now becoming quite loose as the fat's removed. When we're not getting much fat back, we then switch to a cannula that has openings on one side only, and we use that, turn that, and use that up underneath the skin to kind of even things out. Once we've finished all that, most of the fat's gone, and it's at that point that we've got loose skin that's sitting there, and what we want to do is, we know that some of it will tighten up on its own, but if we could heat it to 40 degrees, we know that we'll get a much better result over time. I've never had to use it under general anesthesia at all. The tumescent anesthesia works extremely well. It's very straightforward. You take a bag of saline, you have a 50 ml bottle of 2% lidocaine without epinephrine, that's added to the bag. You add an ampule of epinephrine, and this is what we use for our anesthesia. I think it's vital to go to a course ahead of time. The American Academy of Cosmetic Surgery has a number of great courses that go on. There are a lot of OBGYNs that are members of the American Academy of Cosmetic Surgery, and when you go to their courses, you feel quite comfortable, you feel right at home. And there's a number of other people with your training there, and they will go through how you do liposuction area by area. They'll add on things like fat transfers and tummy tucks and all the rest, and you get great experience when you do so. When you first start, I think it's very helpful to have some hands-on experience, and that is generally fairly simple to arrange. You would go to somebody's office who is doing it already, and go in on a day when they're doing a case or two and get a little hands-on. One of the things that it does take a little bit of time to kind of learn is when an area is finished. And you can do, it's more of a sensation touch thing when you grip the skin and pull up. You can tell when the fat's all gone, or whether there's still some stuff around. And that's something that's difficult to do over like a PowerPoint presentation. You really need to do it. Plus you need to feel how the catheters feel, so you know whether you're pushing too hard or not pushing too hard. Our assumption is always going to be, as physicians, that we're doing everything we can to avoid having a problem or complication, and it's great to feel what is normal pressure, what's necessary pressure. But once you do it, then it's just a case of restricting yourself to an area for a few cases till you get good at that, and before you know it, you'll have somebody come in who, instead of doing tummy, wants to do inner thighs. You'll find that that's very straightforward. You'll maybe change your direction of approach. You may put them in the stirrups in order to get a nice kind of tapered, feathered effect. And as you go along, very quickly you add other areas, and you become quite comfortable.